Hepatocellular carcinoma is basically liver cancer. It is the primary form of liver cancer. It is not super common, but it does have some very clear clinical lab tests that we want to know about, and we want to know who is more at risk for developing HCC. Hepatocellular carcinoma can also be called a hepatoma, and as I said before, it is the primary cancer of the liver. Men are more likely to develop hepatoma, and anybody who has had a previous history of cirrhosis or chronic hepatitis is going to be more likely to develop hepatocellular carcinoma. Clinically, these patients are not going to have a lot of signs, especially if their hepatocellular carcinoma is not due to cirrhosis. So they're going to be pretty much asymptomatic until later stages. At that point, then they will start to have classic cancer signs. If their cancer is due to underlying cirrhosis, then they probably already have gone through all the cirrhotic changes and symptoms. Lab tests for HCC are super important. So we're going to have increased LFTs because the liver is damaged, but the big one that you need to know is that there's going to be an increase in AFP. So AFP is alpha-fetoprotein. If you recall back from OB class, the only time that there should be AFP is in a woman who is pregnant, because the fetal liver does release AFP into the maternal bloodstream. So now if we have a male with a positive AFP, that is almost a guarantee that they have hepatocellular carcinoma. Once a patient is diagnosed with HCC, the prognosis is actually pretty poor. It is probably already far enough advanced that there is no treatment really for the disease. So the 5-year survival rate is 1%. That means people who are diagnosed with hepatocellular carcinoma, only 1% of them are still alive at 5 years. There are some ways that we can treat or maybe delay the inevitable. We can do that through chemotherapy, or the patient can have surgery to remove the hepatoma, possibly remove a lobe. They might be able to get a transplant as well if it's caught early enough. The kind of unfortunate part about HCC is that it doesn't have a very distinct appearance by ultrasound. So we just want to make sure that we are looking through all the parenchyma, looking for any changes in that liver parenchyma, so the patient can either have a biopsy or further imaging to diagnose. So hepatocellular carcinoma does take on many appearances. It can be seen as a solitary hypoechoic mass, or it can be many masses spread throughout. The masses can appear large and heterogeneous, or they can be small and hypoechoic. The main point to know is your patient's history. We want to know what their lab values are, and we're going to really search that liver high and low for anything abnormal. Again, CT and MRI might be better at characterizing liver lesions because they can use contrast, which is still catching on in the United States and not an ultrasound standard. So with hepatocellular carcinoma, I think the biggest takeaway on this is that AFP will be increased. And so if we see an increase in AFP in a male or a non-pregnant female, then we are definitely going to be concerned for hepatocellular carcinoma. Make sure that you are also able to describe what hepatocellular carcinoma can look like by ultrasound.